Welcome to the Institute for Strategic Policy Solutions. My name is Kimberly Jackson, and I'm the executive director of our think tank that's located at the Seminole campus of St. Petersburg College. We're so excited today to talk to you about food insecurity. And again, we have some heavyweights here to discuss this most important issue about how we make sure that we all contribute to reducing hunger in our communities, locally, regionally, and nationally. It's one of the reasons I love working for our think tank that was created by Congressman Bill Young, because he allowed us to address social, political, and economic programs in a nonpartisan way. And that gives us the strength to have in-depth conversations about issues that make our communities stronger. So today I'm honored, and I would like to say before we begin that we were inspired by our president, Dr. Williams, who has talked about her struggles with food insecurity growing up as a child and the importance of how it impacts us daily as a quiet and silent measure of challenges for families. She also talked about how the pandemic has exacerbated this condition. And as you hear from our panelists today, they will be able to share the issues that have created challenges with our grocery stores, with childcare, with food services and school systems, and in general, how we have healthy families. So without going any further, I'd like to also thank our very important partner in this program, AARP, for taking the challenge to sponsor us and for doing the good work of shedding light on these issues in an intergenerational manner. AARP helps people choose how they live as they age through advocacy, education, and outreach. They have had a presence in St. Petersburg since it was founded in 1958. And I don't think most people know that. I myself did not know that AARP had such strong ties to our community, but we're very grateful and honored that they are allowing us to have this program today. And with that, I'd like to introduce our moderator and our panelists. And today, as we have done this over this past year, I'm having co-moderators, which has been quite joyful to share the platform. This one is special because he is an ISPS board member. He is our treasurer and he's a recent graduate, so kudos for graduating from the very difficult public policy program. And he also is a community volunteer and an outdoor enthusiast who loves beach parks and camping. Thank you so much, Aaron. We're going to go through our other presenters today. Our lead speaker is Nicole Heckman, and we're so thankful that you're giving us your time all the way at our nation's capital. She's a social entrepreneur and the director of the Benefits, Access, and Food Security team with AARP Foundation, the charitable affiliate of AARP. Nicole is passionate about a range of social justice issues, especially economic dignity and food systems. Prior to AARP Foundation, she co-founded and led a research and strategy firm that employed a human-centered approach to tackling complex problems in healthcare. She is dynamic. She holds an MBA from Crummer School of Business at Rollins College and a BA in psychology. Thank you, Nicole, for joining us. Our next panelist, Duggan, who I've grown to have a strong relationship with, and I thank him for his service to our community, has a fundraising career at the age of 6 with his door-to-door request to support him in his annual community bike-a-thon. I'm impressed by that. In 2016, Duggan was hired by Panelists Community Foundation, indicating its board's desire to enhance the trajectory of the foundation, and he was giving a near blank slate to envision the 48-year-old institution, which is important because as it reaches its 50th anniversary with a solid brand, enhanced presence in the community, it has ever increasing assets, which are now over $130 million. He's a longtime resident of Pinellas County and a true advocate. Prior to PCF, he served as the president of United Way of Pasco County. Thank you also, Duggan. Our next panelist is also very special to me. She is a strong advocate in the community and cares about how we grow responsibly and for all neighborhoods, diverse and otherwise. Jennifer Yeagley has a master's and is a Tampa Bay-based nonprofit executive with 20 years of organization and community leadership experience, having served most recently as the vice president for administrative and strategic operations for Gulf Coast Jewish Family and Community Services. Over her decades of service, she has served organizations in Texas, California, and Florida. Prior to this, she was the executive director for Community Tampa Bay, an anti-discrimination organization focused on dialogue and education. She was on the advisory board for the Foundation Center from 2010 to 2013. She has presented in forums locally and around the nation on diversity and cultural competence, including the National Association for African American Studies, Mid-Atlantic Women's Studies Association, and Florida Philanthropic Network. She brings a heft of responsibility and experience to the St. Petersburg Free Clinic, and we're so proud to have her on board as leading this huge entity in our community. And finally, we have Shana Bent, who is no lightweight herself. She joined St. Petersburg Free Clinic in 2011 as a volunteer in the food party. She joined the staff shortly after and has multiple roles, including director of We Help, director of food programs, and now serves as the Free Clinic's first chief operations officer. She established a reputation in her community, our community, as a prominent advocate in the fight against hunger. In addition to her duties with the Free Clinic, she serves as the chair of the Juvenile Welfare Board of Pinellas County's Childhood Hunger Initiative, and additionally served as a member of the board of directors of Gulf Coast Legal Services since 2015, and served as president shortly thereafter. So now, Erin, I turn this over to you, where you have a panel of experts to talk and shed light on food insecurity. And today we're going to have a very open dialogue and conversation. We invite our panelists who are participating to answer questions in the chat, and those who are here to join us today, if you will please put your questions in the chat or the Q&A, and we will do our best to try to respond to them. Thank you all.
Thank you so much. Thanks for sharing the stage with me today. I think it's going to be a wonderful program. We have some incredible panelists, and it's a very important topic. So with that, why don't we just dive right in? Our first question is going to be, food insecurity is becoming an increasingly severe issue in the United States. What are some ways your organization have tackled this issue head on?
I'll jump in and start with that, because the St. Petersburg Free Clinic is a boots on the ground organization directly addressing food insecurity. We serve Pinellas County specifically, and we have one of the county's largest food banks as well as one of the county's largest food pantries. So in our food bank, in 2019, we distributed just over 11 million pounds of food throughout the county to up to 60 partners that we work with on any given month. This year, mid-year, we have already surpassed that and have distributed over 12 million pounds of food into the community, and are on track to do quite a bit more before year end. Likewise, in our food pantry, which is sort of our indicator of what's happening on the ground in terms of how many people are needing to access food pantries and other sources of support like that. And consistently over the course of the last 14 months, we have served an average of about 20,000 people per month in our We Help food pantry. And that is up from about anywhere from 6,000 to 6,500 people pre-COVID. And so we have clearly seen the impact of the pandemic on our community with respect to food and food insecurity. And importantly, one of the lessons that we have learned, and plan to take forward, is how important it is to not just respond to people's need for food, but also respond to their need for health and nutrition. So we have really placed a clear and direct emphasis on making sure the food we distribute is fresh and healthy. Consistently over 75%, and sometimes much more than that, of the food that we give away through our food bank and our associated food pantry and our other partners is fresh. It's fresh produce, fresh meat, fresh dairy. We really want to be sure we're contributing to the overall health of all of the generations in our community who may be finding their way to us for support.
Fantastic. I think one thing that stands out is just the sheer number of residents you're reaching out to, and also the fact that it's produce. It's healthy, wonderful food that actually is going to contribute to the health of our residents. So, I mean, that alone is just a mind-boggling concept. So thank you for your work and the work that you guys do over there. And on that point, it's actually interesting because I'm associated with a neighborhood association that actually started a regular food drive in partnership with this free clinic. So that's just one small example of, I think, a different variety of ways we can kind of tackle this issue. But thank you again for the work you guys are doing. So for our next question, how can individual residents or households contribute towards the end of food insecurity in America?
I think one of the things we've seen in this pandemic is the normalization of those who need services. over half of those that we're now serving pre-COVID had never before visited a food pantry, had never before sought assistance. And so now there's this, I think, understanding of it's okay to ask for help. Most people now know someone who's visited a food pantry who has needed some sort of financial assistance throughout the past year, that this is not some sort of abnormal outlier. It's not, when we think of, you know, those who need help, it is now my neighbor who needs help, my child's teacher who needs help. And so it's really, I think, just people become more aware. And that's one of the things, even pre-COVID, I would ask of people, is to really understand the problem in your community. So many people would come to the free clinic and they'd come for a tour or they attend one of, you know, these presentations. They'd always walk away with, I had no idea. I had no idea this was a problem in my community. I had no idea that the numbers were so severe. And I think one of the things, one of the easy things you can do is just become aware and become involved, because understanding, one, that there is a problem, that is how we start to become part of the solution.
I think, Shana, you raised some really, really good points. And I think even back to 2016, Panelists Community Foundation took a year to focus on the issue of childhood hunger in our community. And that was the constant response that we would receive from people. I had no idea. But I think you're right that COVID, it affected our entire community, and the financial need that has created a greater food insecurity issue in our community has highlighted that this is your neighbor. And folks who want to get involved can support organizations just like the St. Petersburg Free Clinic. There are volunteers that are needed to make the work happen. There's money that's needed to make it happen. But I think it's really important to highlight again the point about getting educated about the issue. Who is it, and that the need is real. And it's not just somebody else. It is your neighbor. It's your neighbor. It's my neighbor, and it's a growing issue within our community. And I think to find ways to participate in the community, we have growing numbers of networks out there that are trying to work to address the challenges of food insecurity. And so the newest, I believe, being the St. Petersburg Food Policy Council, trying to look at what policy can change, what kind of promising practices are out there. Some of them already employed by organizations like the St. Petersburg Free Clinic and some of our other partners in the community. But to find groups like that and work in partnership with others that are doing this work to help make sure that we are doing everything we can together to address the food insecurity challenges of our community.
And building on what Dugan was just saying, and Shana, a lot of times when we think about food insecurity, we think about families with children, which is a very, very important part of our community. And what often is less visible is the food insecurity amongst older adults, which at AARP we look at as those 50 and older, right? So during the pandemic, we have seen food insecurity skyrocket to 16 million older adults. As of March of this year. That is 6 million more older adults than we saw pre-pandemic. Similar statistics exist for families as well. And at the foundation, one of the things that we're doing a lot of work around is helping to get older adults enrolled in SNAP, making that easy and keeping them connected to the program. And for anyone not familiar, SNAP is the Supplemental Nutrition Assistance Program. And the reason I'm bringing it up in response to this question is that in Florida, there are about 300,000 adults 60 and older that are eligible but not enrolled. And that's for a whole bunch of reasons. And oh, by the way, Florida is actually doing a better job than many other states at getting unenrolled older adults into the program. But there is a lot of misinformation and stigma about the program, and we need everyone's help to bust through that misinformation and to normalize the use of SNAP. This is a program that we pay into through our tax dollars and is available to all of us when we need that extra assistance to make sure that we're eating a healthful diet. So that's one of the things that I would ask of everybody, is to help us spread the word about the availability of this program and how it is a normal part of putting a healthy diet on the plate.
And Nicole, thank you for highlighting a solution there, because in 2019, our foundation worked with a number of other partners to launch the community assessment survey for older adults for our community. And one of the top resident needs that was highlighted of our older community was a health need, in particular, maintaining a healthy diet. And so I appreciate you bringing up SNAP as a solution, and the work that we need to do together to raise the number of people who are aware that they may have access to that and should apply and receive that as a benefit to help them address their own needs.
Fantastic. You know, what really grabs me from that dialogue there is, number one, how we're kind of discussing the personalization, you know, how these are our neighbors, you know, these are our own local community members, and it's not just those people, or it's not some alternative concept. It's someone that we know and that we care about. And when we're talking about that, it really speaks to the importance of the local work we're doing right here in St. Pete, right here in Pinellas County, right here in the state. So the work that you all are doing is, again, just tremendous and a wonderful contribution to combating food insecurity. Nicole, when you were talking about SNAP, I think that's a wonderful point as well, because it is an example of a great resource, an untapped resource that I think a lot of people, if they did tap into, would again address this issue head on. Do you think there might be any other resources you could think of that you would recommend for others as well?
So I will say, while SNAP is not a perfect solution and there are changes needed to the program, there are promising practices even within SNAP that I'd like to talk about for just a moment. So Florida has actually done a lot around making SNAP easier for older adults with the adoption of the Elderly Simplified Application Project, which streamlines a lot of the paperwork and it lengthens the certification window. But some of the other things that could really help is that there is this excess medical expense deduction, which for adults 60 and older or those living with a disability allows them to claim their medical expenses as part of their SNAP application, and it will increase their benefit amount. And so this standard deduction makes it much, much simpler to do that. Right now, only 8% of those 60 and older that are participating in the program are claiming their medical expenses. So by putting a standard deduction in place, it just makes it much, much simpler. I would also emphasize that there have been a lot of temporary changes made to the SNAP program during COVID, with waived recertification waived recertification interviews or eligibility interviews, telephonic signature. These are things that we can collect data on through the course of the pandemic and make the argument that these changes should become permanent. And we can really just make it a lot easier for people to participate in this program and receive assistance. Not to mention the fact that right now we're experiencing maximum benefit amounts that the federal government has passed through congressional legislation related to COVID. And we should really be looking at how can we keep some of these things in place to actually move people to a place of food security. We recently did a study with Mathematica and evaluated the effectiveness of SNAP on food security. And what we found is that the benefit amount matters. And a lot of times what people are receiving on a monthly basis is insufficient to really move them from food insecure to food secure. So we need to be making that argument and doing so over the next couple of years as we're looking at the Farm Bill and opportunities to make changes to this particular program that serves so many Floridians.
Well said. And I think a huge part of that is example of this program, you know, just getting the word out, letting people know that these resources are available. And on that point, you know, I think of the St. Pete College Gibbs campus has a food forest that's actually self-sustaining. They use whatever breaks down to just kind of feed into it and continue it. And it's used as a source primarily for education and talking about the issue of food insecurity in our community. And so I think awareness, education and advocacy is critical. So thank you for sharing that on the resources available. So with that, why don't we make our way into our next question? What recommendations would you have for current policies and/or funding levels at the federal, state, and local governments to address food insecurity in the United States?
I think this is a possibly policy, perhaps funding related. I think a critical mindset or orientation for lawmakers at every level, whether it be federal, state, or at the municipal, city and county level, is an understanding that a lot of the rubric that is in place to qualify people for services is extraordinarily outdated and has not kept pace with the economic changes that we have seen over the decades. So we are currently in an economy, pre-COVID, we were in an economy where the cost of living has skyrocketed across the country relative to wages. And so we've seen wage stagnation, and in Pinellas County in particular, we've seen wage stagnation among low and middle wage earners. And we have seen the cost of living continue to increase. So in Pinellas County right now, the average cost of renting a one-bedroom apartment is about $1,300 a month, which is largely unaffordable for most people. And on the services side, those of us in the service sector who are providing any number of services, including resources around food and nutrition security, it's often really difficult for folks to qualify to receive those services if they have income or if they're receiving some sort of benefit, because they're not on the lowest income end of the spectrum where people tend to be able to qualify for more services. And so we have thousands and thousands of people in our community who don't qualify for things like Medicaid or may not even qualify for SNAP, because even with the extension of SNAP, it is still leaving a vast gap in how people who are struggling to make ends meet can actually qualify for that service. And so in terms of, I think one of the most powerful things that we can advocate for, even before funding, on a policy level, is revisiting federal poverty levels and how we calculate those, because those are extraordinarily outdated. Looking at how we allow people to qualify for necessary basic needs services and get into programs that will help them, their families, their aging parents and grandparents, just really, support our communities overall from an economic standpoint. And I think when we begin to address that, then more people can access critical services and we can begin to chip away at some of those gaps. For our purposes of the free clinic, we don't have a qualification process to access our food pantry. We make it as easy as possible for people to come to us, receive the food that they need, no questions asked. And we make really deliberate decisions to keep things that way. But we recognize that we sort of have a luxury in doing that, where not every food program can do that. And so really we need to work together to reduce these outdated client or service eligibility criteria.
I couldn't agree more with what Jennifer is saying, in that when we look at food insecure households, the biggest trade-offs that are being made is food or paying rent or the mortgage, right? Food or healthcare, food or transportation, right? And food or utilities. And when we talk to older adults at the foundation, what they tell us is, well, I can skimp on my food. I can be a little hungry, right? I have to pay the mortgage. And that is heartbreaking. We really need to be looking at this problem much more holistically, and we need to be revisiting what we consider to be poverty and what it takes to live in this country and have the dignity of choice and of living a quality life, right? Like yes, sorry, I'm getting a little bit worked up here. The other thing I would add is that food security should actually be reframed as nutrition security. And we're starting to hear this amongst researchers and advocates and even policymakers, that food insecurity has devastating health outcomes. And we really need to be looking at it as a lack of reliable, affordable access to a nutrient-rich diet. It is also an economic problem. Food insecure adults tend to spend almost $2,000 more a year on healthcare. So if we could actually work to improve the food or nutritional security of these households, we could be reducing healthcare costs. So I think we're looking at it today in a much too segmented way, and that we're missing the forest for the trees.
I think you're very right, Nicole, and I'm happy to see at a local level that the organizations that are working to address food insecurity in our community are also working to address that nutrition insecurity issue. And we're seeing a lot more fresh, healthy, nutrient-rich food be delivered out of our food banks and food pantries. We're seeing more of that arrive to our food pantries. And for years, our network of providers has done a great job helping the community to better realize the better food that is needed, because at the end of the day, if it is junk food, if it is canned food that is high in sodium, and it affects health, and many of the people that come and need food from food banks and food pantries are having other issues addressing their health concerns, and so it just aggravates those conditions. And so it's wonderful to see that start to change. But more work is needing to be done there, and to raise the profile of the fact that exactly what you said, that food insecurity is a nutrition insecurity problem.
Well said. I think it's, again, what we're talking about here is really, and it goes back to what the St. Pete Free Clinic is doing by offering the fresh produce. It's trying to change the conversation to, it's not just about food, it's about nutritious food. It's about making sure people are healthy as well as fed. So wonderful points by all of you. Thank you. So with that, we can segue into our next question. So for our next question, how are other cities, counties, states, or even countries choosing to handle food insecurity? What lessons can we learn from them?
I think as we look around to what other organizations are doing, particularly over the past few years, we've really seen a focus across the country when you look at best practices and kind of food banks and food pantries. One is there is an increased focus on fresh food, but there's also an increased focus on the overall health and education aspect of that. Just simply handing out bags of food is not enough anymore. It is really engaging with the individuals who need that assistance, helping, if it's with recipes or food preparation or education, or engaging the families in a way that you're not, again, just throwing bags of food at them. It is meeting them where they are. We've seen an increase in high school food pantries. We've seen in elementary schools, it's not just a food pantry, but it's a whole program. It is a food fair, and really engaging with families and engaging with individuals, and again, normalizing receiving food and understanding that not everyone knows how to cook an eggplant. And so handing out eggplants is not really helpful. It's not going to feed a lot of people if no one's going to eat them. And I think when we look around at what other food banks and food pantries are doing, it is really the focus on education and nutrition. And I think that's really what's changed in the last few years.
I've seen, to Shayna's point too, I've seen a growth in the number of organizations that are also starting to educate around being able to grow your own food. They're doing that at the location. They're actually using the produce that comes from gardens. They're teaching people that are coming to the program about the variety of food that can be grown locally. And I think that any growth in that also helps to the extent that people have available space or can grow some of their own food at home. It's that education piece that helps solve that challenge as well. It seems daunting if you've never done that before. It's fun, maybe you did it during COVID because you had some time, but when you're trying to work and sometimes multiple jobs, figuring out how you're going to garden as well and what to do, sometimes it's the simple bit of education that helps give people the confidence that they need to address their own personal challenges and that of the community around them.
Yeah, and I would just add, so Shayna and Dugan said this so well, the culinary confidence is really important to be able to feel confident buying that eggplant, right? That maybe you haven't had before. And when you're trying to stretch your food budget, that's a big decision because there's this concern, if I don't like it, now I've wasted that $2.50 or however much that might be, right? So one of the things that we've seen be really effective paired with education is incentives, so fruit and vegetable incentive programs that provide a voucher or some sort of monetary value specifically for fresh produce that helps to lower that financial burden of trying that new food, right? And we've actually seen some great evaluations of these programs that even after the incentives stop, people continue to purchase more fruit and vegetables. So they reallocate their existing food budget, however limited it may be, to buying more fruit and vegetables. So I would name this as one of the other promising practices that we've seen as well.
Wonderful. I think it's a big part of it is really just looking at the different practices that are out there, but also again, just hitting home on the education piece, because you can, like you were saying, Shannon, you can feed plenty of people, but if they don't know how to prepare it, or if they're not utilizing it the best way possible, then that's a missed opportunity. So I think that's a wonderful point. Let's go ahead and jump to our next question, which we actually touched on a little bit earlier, dealing with equity. So the question is there an intersection between food insecurity and affordable housing? If so, what can be done to address both of these issues simultaneously?
And I think Nicole touched on this a bit. There definitely is an intersection between both. And in our community assessment survey and of older adults in 2019, top issues, one of them I already highlighted, being health and access to creating an affordable, healthy diet. But the variety and access to affordable housing was another top issue. And so we do see, and anecdotally and through actual survey results, know that our older adults are doing exactly what Nicole said, picking and choosing between whether they're going to pay their rent or how much food they're going to eat. Are they going to pay for the prescription medication that they need, or are they going to eat? And so making sure that we have programming that addresses those needs simultaneously is helpful. The other sort of need that gets woven in there, and I think is a challenge sometimes unique to Florida, where we don't have as robust access to public transportation, is the transport necessary to get what you need. And so it is nice to see the continued growth of programs like our Meals on Wheels programs, which have pretty stringent nutritional requirements, making sure daily dietary needs are met of our older adults, but getting the food to them at their home. And the other thing that programs like that do, allow a person to sort of check up on people and find out if there are other needs that surface or are surfacing. And as you build relationships, sometimes people are more apt to tell you that they're having a challenge paying the rent or the mortgage, or that there's another issue that is arising. But being creative in how we deliver our solutions to address food insecurity and hunger are important.
And to build on Duggan's point of access, when you talk about affordable housing and building affordable housing, you also have to build grocery stores. And that is a significant issue in Pinellas County, as well as many other places across the US. The families can't get to the grocery store. There's not one close by. They lack transportation. There are issues with access. There are, they may have access to a convenience store. There's no produce there. Or if there's fresh milk, you're paying $6 a gallon instead of $3 a gallon. And so it's not just, providing affordable housing, it's providing affordable housing in areas that have access to nutritional food, to grocery stores. It's all about access.
Yeah, and I'll just add on the point of creative solutions in this space. So obviously adding to the affordable housing stock is not easy. But for individuals that are in affordable housing, the application process for affordable housing collects a lot of information about the residents, including their income. So we're working with right now Mercy Housing in California to pilot a new solution that would allow them to actually reach out to residents that they know are SNAP eligible, for example, and help them with a seamless way of applying for SNAP, because we already know that they're more than likely going to be approved. And then if we take that one step further, why don't we just determine that individuals where we have the incoming information are categorically eligible? Why do we need to go through a really rigorous and often dehumanizing process to make people prove they are poor enough for an assistance program? Can't we flip the script and make it so that you're automatically deemed eligible, right? Because we already have that information.
You know, when I think about this, I really think about how it comes down to access. It comes down to having sustainable options for people. You know, the notion of a food desert is something that's actually becoming increasingly prevalent nowadays, particularly in St. Pete and in our area. And, you know, that notion of having to go to a convenience store instead of a grocery store, not having that access to fresh produce and nutritious food, or not even having the transportation to get to a location where they can get that access. So wonderful, wonderful points, and a good segue into our next question as well. So for our next question, why is addressing intergenerational food insecurity so important, and what economic factors play a role?
In thinking of this question, I'm reminded of a story of somebody who was a patient of ours in our health center, where we serve those who lack health insurance. And as Nicole had said, you know, your point about we should just make the assumption that people categorically qualify for the services that we're offering. And that's, you know, one of the things we do in the health center is say, if you're coming to us in our health center, we are going to make the assumption that you could benefit from some food support as well. And so we're working on addressing that, you know, via the programs we already have established. And a story of one of our patients is that she was living in an intergenerational household. She was caring for her father, who is a senior, and she also still had children living in her home. And her father's medical benefits had been reduced, and he was on an extraordinarily fixed income. She's caring for this intergenerational, multi-generational family, working, but lacked health insurance, and was talking about how every month, you know, she just budgeted every penny so carefully to make sure that her family could afford to eat, that they didn't have to skip, you know, she didn't have to skip doses of her medications. And so this individual story just really illustrated the intersection of affordable healthcare, housing, food insecurity, nutrition insecurity. And I think that more people than we know are living in this intergenerational sort of, if not one household, are in a position where they've got, you know, they may have children as well as are caring for, you know, seniors in their lives, parents, in-laws. And this is the composition of so many of our families. And so when we are able to take an intergenerational view on nutrition and food insecurity, we get that view on just a whole variety of concerns and challenges related to, again, how our economy is set up, that we're then able to address issues holistically and not in a vacuum. We really need to understand that, you know, when somebody is food insecure, they're going to have all these other challenges, as we've already talked about, and there are likely going to be intergenerational issues connected. And so it is all connected. In the extent to which we can pull ourselves out of that vacuum, you know, from a policy level, a services level, a funding level, that we can better address the issues over the long term.
Wonderfully said. Does anybody else want to jump in for this last question?
Less on the intergenerational side and more the economic factors. And I think we're in a very interesting time with the starting decline of stimulus funding and the available financial assistance for many individuals and families. But we're seeing dramatic increases in the price of food and the price of fresh food at the grocery store. And I think every time I'm fortunate enough to go to the grocery store, it's almost like sticker shock every time. And the more limited your budget is, the less you are going to buy the things that you really need, the healthy things that you really need. And we're seeing that happen in conjunction, especially locally, with a dramatic increase in the cost of housing in our community. And both of those stand to create quite the storm for our community in addressing the long-term health and security of our entire community, especially the most vulnerable, as you look at both ends of the age spectrum. Our children and our older adults stand to have greater impact of both of those issues if, as a community, we don't start looking to new ways to address both the food and affordable housing challenges we're seeing.
Well said. Well, allow me to thank each of you for coming here today. You've been a fantastic panel with an overwhelming amount of incredibly important information. I'll hand the microphone back to Kim there, and thank you all again very much.
You all, thank you, Aaron. But I just want to say that the topics that you put forth are so complex, and there are ongoing complexities with the intersectionality of disease process. We know people who have heart disease, we know people who have diabetes, we know people who have MS. And then you layer that with people who have poverty, housing issues, and cultural issues. And then you layer that with people who have been impacted by COVID and a new population of persons who are coming into the fold who have food insecurity. And as you all mentioned, from literally childhood to as we age and we're more seasoned individuals, for lack of a better word. And that puts a challenge on you all as well as with the homeless population. I'd like to the extent we can, get to some of the questions from our participants. If you will each comment on, I'm going to lump them together in the interest of time, how are we addressing the homeless population? How are we teaching people about food deserts and what they can do to sort of help sustain themselves with learning more about how they can grow and have alternative methods of use of food? And what are we doing to identify the gaps of services so that we can actually have an action plan moving forward? And I'll just continue to lump them until we run out of time. Thank you, Nicole, if you don't mind starting.
Sure. I'd actually be very interested to hear from the rest of the panel on what you might be doing in Florida around the homeless population. That is an area that we're extremely concerned about. We know that economic stimulus payments, for example, have not made it to so many people that don't have a physical address. So this is an area I look forward to hearing you all talk about. In terms of some of the gaps that we're looking at, so we are obviously very focused on the SNAP program and looking at where that program may be insufficient. And one of the reasons that we are so focused on this program is that it represents 94% of the federal government's funding of older adult nutrition support programs. So it is where the bulk of the funding is going. We would like to see more allocated towards the fruit and vegetable incentive programs that add on to this, as well as the commodity supplemental food box program, and also easier for older adults to use the Senior Farmers Market Nutrition Program, which is a fruit and vegetable incentive program that can be leveraged in addition to SNAP benefits. The other thing that I would highlight is that, food is just one part of the overall household budget, right? And so one of the things that we have noticed is that a lot of individuals are eligible for multiple programs, right? But they may only be enrolled in one thing. So an example of this would be the Medicare Savings Program. So for individuals who are Medicare eligible, Medicare eligible age, if they are at a similar qualification to SNAP, they would also qualify for this MSP program, which would cover their Medicare premiums and also include extra help, which is prescription coverage, right? And so making sure that we're identifying individuals who might be able to partake in both of these programs and knowing that the additive benefit to their household would be significant financially, and it would work at that cross section of both food and healthcare.
Jen, can you jump in and address some of the concerns that Nicole was asking regarding the homeless population? And if you could also intertwine how you're helping people apply for SNAP and understand what it is. It's a term that if you're in the industry, most people know, or if you need assistance, but generally the communication messaging to assist people, if you could address that, that would be great. Thank you.
Shayna's the best person to answer that question.
As far as the homeless population, so there are a number of services throughout the county who specifically target, those who are without a permanent residence, through hot meals, through kind of, pre-made food, sandwiches, those sort of things as far as the food. But the resources is kind of where we are really able to assist. So anyone in Pinellas County can access our food pantry. And so it doesn't matter if you have a house, if you have an ID, we are here to serve you. But one of the things that we do that I think really moves the needle on this is we have a client advocate who works with individuals to access those services. So if they need to sign up for SNAP or they can't get their stimulus payment, it is hard for people who don't, if you don't have a house, if you don't have a phone, if you don't have a computer, to access these things. Fine, go to the library. Well, what do I do then? And so to have someone who will sit down and walk you through those processes, to understand, really go through step by step to apply for these resources, to register for SNAP, to create a mailing address, all of those things has been critical. And we've really seen that have significant impact on people's ability to access services, whether it be SNAP, whether it be housing, whatever it is. It's those barriers. It's those barriers that Nicole talked about earlier. It is this website with 50 questions that I don't know how to answer and I don't know how to navigate. That is a barrier for people. And so we really try and break down those barriers and assist people through that process. There's one other question that was related in the chat.
If I could jump in while Shayna's thinking too, because I think I saw a question related to, and there's two things. So one, Shayna had mentioned earlier the importance of access. And I think that's also how we help reach people who are unhoused, otherwise lack access to services, getting really creative about getting food into communities at the neighborhood level in ways that are accessible to folks who may be unhoused. And, they can't get to the downtown, we help food pantry, they can't get to the client advocate here. But creating those pop-up, whether it's a pop-up mobile pantry, which we have been doing more of over the course of COVID, and are really assessing where can we go to make sure that we are helping people at that neighborhood level, having the walk-up capability for that, which we do have, both at our mobile pantries as well as at our food pantry here downtown, where it's a drive-through now because of COVID, but if you don't have a car, that's okay. You don't have to drive through, you can walk up. And then working with our community partners to really understand the need that they're seeing at the neighborhood level. And a lot of what we have been doing this last year is finding new partners and helping them establish their own small food pantries because they have identified a need within their neighborhood. Either for folks who are nutrition and food insecure or nutrition and food insecure and unhoused. And so it really is that neighborhood based, like where are people who have the need, and then just finding a way to meet that need, which we have just really been flexible in being able to do. And I want to speak just for one moment about the question about stigma and reducing stigma in accessing services like a food pantry. We have found that the drive-through model that we were forced into as a result of COVID actually went a long way in creating access for folks who prior to this time may have not wanted to walk into a place that identifies itself as a food pantry because of the stigma associated with it. So we have now created this increased sort of more anonymity, this ease of use. And we know for sure for our purposes, we're going to bring back an element of that indoor choice food pantry model over the coming months, but we are unlikely to move away from that drive-through model. We know it needs to be a both and, because we want to do everything we can to make it easy for folks to get nutritious food. And we want to continue to advocate in forums like this, as Shayna already said, everywhere where anybody will listen, normalize the fact that this is not your fault. if you don't have a full pantry, a full fridge, a full cupboard at home. We know that people are doing everything they can do to make ends meet at every level, no matter who they are. Our economy is not set up to support folks in all of the ways that they need to be supported for all kinds of reasons. And so those of us providing services like food and other basic needs are here to help, and we want to normalize that.
You all are both making me think about two specific words, dignity and service. And one thing that I appreciate about our community leaders who assist in this is that you understand that dignity is connected intimately into how a person thrives. And so the transportation you mentioned, or cultural issues, or physical, or disability challenges, all tie into how you eat and thrive. At least in our county, Nicole, we have 5 poverty pockets that have been consistent over several decades, and we know where to serve. I think a bigger issue is teaching the community to know who to go to for what. I think our nonprofits work really good in that regard. If you will talk, each of you, on how you work with medical providers to put out the word and have them teach their clientele, whether they're doing it in clinics or in their personal practices or in the hospital in terms of outreach. And then that balance, that delicate balance of self-education and responsibility around this subject, because there's questions about that too in the chat. Thank you.
I don't want to take up all the space here, but because we are working directly because we are a health program and we're working directly with other partners in the community around health, I'll just briefly speak to it, and Shana, please do chime in. But we obviously, through our own health center, which provides primary and specialty care, as well as diabetes education management, mental health services, and drug assistance for free prescription drug support. So we have a whole gamut of services we provide. We have a food pharmacy, but we also make sure that we are pushing nutritious food out to patients in our health center, even if they're not getting they don't have a chronic condition that would warrant, maybe getting a specific food box. And so we directly sort of meet that need, but we also partner with Baycare, Bayfront, and other hospitals and other medical sort of providers in all kinds of ways. So we have done things like a flu shot clinic at our drive-through We Help pantry. And so, we're sort of connecting the dot between folks who are coming through here, receiving food, who may also need a flu shot. We create that access, and we've done a couple of not just flu shots, but screenings. So where we bring our medical partners directly to the food pantry and find innovative ways to make those linkages. And every time we do that, we're also educating our partners in the medical community about what need really looks like on the ground. A lot of people are surprised when they come to this building here, or when they're trying to get to it, they can't get to it because the line for food stretches around the block. And that's very eye-opening for many, including our medical partners with whom we engage. We also, work to get for Baycare, which provides food boxes through their clinics. For example, at St. Anthony's, we have a rack card that goes in all of those boxes that lets people know where our We Help food pantry is. So when that food box is empty, they know where to go just around the block from where they got that food box to come back and get access to fresh, healthy food. So those are just some examples of the ways that we're working with the medical community to create that link between health, medicine, and food.
And to build on,
Go ahead.
sorry, to build on what Jen was saying, as a national organization, our take on this is a little bit different, but complements everything she was just saying, which is so vitally important. So we have grant funded a lot of organizations doing the type of work that she just described, whether it's Produce RX, right? So a prescription that you get to then shop at a food pharmacy, medically tailored meals, where if someone is diagnosed with a chronic condition, they can actually receive meal support and nutritional coaching to help them to adopt these foods into their diet and have them maybe pre-made when they first when they're first getting adjusted to a different diet, to make that easier, right? There's a number of interventions that are being rolled out in tandem with the medical community. And so one of the roles that we take at the foundation is funding some of these efforts that are building the evidence to then make the case for systems change. So what we're starting to see is that health insurance companies and Medicaid and Medicare are beginning to pay for some of these things that have evidence behind them as ultimately reducing healthcare costs, right? Screening for food security in a medical setting, all of these different things, we're looking to make the argument that it is good business for healthcare companies to actually fund these things, which goes back to my previous conversation, is this is much a healthcare argument and an economic argument as it is about the food, right? So how can we support that work? How can we lift it up, make sure that it has the visibility and the rigor behind it to put effective solutions forward?
Thank you all so much. As usual, we come to the end and I have to do a big ask. Please, if you can, put in the chat or in the panelists / attendees, any links that you think might be helpful for our participants, because we did not get to all of their questions. I know we have the food index. It's an AARP tool that I grew fond of going to a conference, learning about this intersection of intergenerational food challenges. At SPC, we have a lot of students who take care of their grandparents and then are still going to school and then take care of their kids and then have challenges with medical support and then have challenges with food and then layered with all the topics you all said. If you could talk specifically, if you know about how we're getting local farmers perhaps to work with communities or drugstores, that's one of the questions remaining in the chat. If you could also talk briefly for our last question before we wrap up about how we're creating outdoor food forests or you pick your own garden spaces. And finally, if one of you all would talk about one issue you would ask as an action item to our participants about food insecurity, what would you ask them to do charging out to spread the word in a more organic way? I would appreciate it. And I see we're rolling in. Make sure that you put panelists and attendees, and thank you so much. So Duggan, you haven't spoken. Would you like to have one of those last words about support? And then we'll do a round the robin before we end.
I just, the only thing, not so much about support, but I just wanted to address sort of that delicate balance of personal responsibility and the services and programs that are offered. And yes, to a degree, the taking care of your own health and addressing food security is an issue of personal responsibility, but many times over the years, I have seen people do everything right and work multiple jobs, do everything for their children, save as much money as they can. And it's one issue or one situation or one health event that takes away everything that they have worked for, and they find themselves needing the help. And so it's very important that our community, I think, work together to continue to support great organizations like our St. Petersburg Free Clinic. We have many church and community-based food pantries that need volunteers and need assistance, but that our community step up and show people that it cares when you have the ability to do that. I think that is an important part of the vibrance of this community, and it's great to see when people do that.
Nicole, I'm going to give you the last word, and we want to thank again AARP for sponsoring this most important talk. I see that Jennifer Yeagley put her information on the in the chat, and please continue the conversation. We know that we have challenging issues. We know in our community that communities of color, communities of non-access, transportation, people who are older, people who are younger, and I would say again that I'm very grateful to have a plethora of leaders in the community who try to resolve the issues that are sometimes overwhelming and don't always have an easy solution. I want to thank you, Jen and Duggan and Shana, but Nicole, I want to give you the last word before we promote our next program.
Thank you. And actually, I want to echo what Duggan was just saying, right? We don't know what someone is going through on a daily basis. And to that point, so many people are doing everything they can to make ends meet. And one of the things that we see a lot with older adults is that people have life events that come up that you can't possibly predict, right? A major health crisis, loss of a spouse, a natural disaster, right? Things that disrupt what you thought was you were doing okay, right? And all of a sudden you're not. And we need to have compassion, we need to have empathy, and we need to take a moment and understand people's situation and connect with them. I mean, that's never been more important than now, as we're hopefully emerging from this pandemic, and really approach this topic with humility and just taking the time to understand what's really going on. So I'm going to close with that. And I just really want to thank you for inviting me to be part of this event. I've really appreciated it, and really appreciate hearing what everyone is doing at these great organizations here in Florida.
Thank you so much, Nicole. We appreciate your time and your contribution, as well as all of the other panelists who I can assure you work very hard to make Pinellas a better place. And with that, we are out of time. We have one program to promote. We invite you to learn more about ISPS at isps.spcollege.edu. We have a Facebook page. We have a new Instagram page. We're connected intimately on our website, and our goal is to have these deep dive conversations to educate the public so that they understand the topics that challenge all of us. If you will put our last slide for our event for next month. So in June, we're going to touch on mental health and the criminal justice system. We appreciate Sheriff Gutierrez, who is passionate about this issue, having a conversation about this, along with NAMI. And we believe we have the other legal entities supporting us, and some commissioners might come to moderate it. So we're very grateful for this space for our June program, and continue to come and follow and be a part of ISPS. We certainly appreciate it. And I'm always doing the last bit of wrap up with us. But again, I want to thank the community for allowing us to do this, and AARP St. Petersburg Free Clinic and the Panelists Community Foundation, and Erin, our board member, for joining us for today's program. Please follow up and continue the conversation.